In yesterday's Sunday papers, they were full of adverts taken out by the government. They combined practical advice with reassurance about the NHS's state of readiness. But how would an already stretched health service cope? Let's talk now to Niall Dickson, the Chief Executive of the NHS Confederation. Morning to you, Neil.
Morning.
How ready do you think the authorities are? I mean, I think what we got there was a sort of, they muddled through in the end with this chap.
Well, I suspect that the people at the end of 111, remembering that this ship had just arrived and all the rest of it, probably weren't aware of that particular circumstance. But my guess is, without over-interpreting what he said, was that they managed to work out what level of risk he posed and then did the right thing, which was to tell him to self-isolate. I think that overall in this country we have a pretty good system. The NHS itself, our members, are well used to dealing with emergencies of various kinds. They're also very well used to dealing with infectious diseases. I mean, we've had 600 plus beds with norovirus that have had to be closed. The system is under enormous pressure. It's like more than 90% occupancy. On the other hand, seasonal flu isn't quite as bad this year as it was last year, so the impact of that is less. But in terms of how it's managing at the moment, I think it will be fine. Obviously, there are contingency plans if things got worse in order to adapt the health service and indeed to protect it, to make sure that people do that. Dial 111, don't go along to the GP surgery, don't go along to the hospital.
I suppose when the NHS tends to deal with an emergency, you think of a terrible car crash or plane crash or a terrorist attack or whatever it happens to be, they're pretty localised. If coronavirus arrives in the UK as a sort of part of a pandemic, then you're talking about the whole National Health Service having to adjust.
That's right. And it depends, of course, on how great a threat that is. So the good news bit is, I think so far we've been very good at doing the basic things, which is around identifying cases, isolating, containing. We've managed to do that. Of course, at some point, if the virus really became well established in this country, that would all become much more difficult. The good news, I guess, is that the severity of this virus looks to be less than, for example, SARS was, or some of the other viruses, though certainly things like Ebola. So for most people, it'll be like a bad cold or flu. The people who are likely to be affected and who the NHS will have to manage, as it were, and that might mean postponing operations or whatever else, will be those whose immune systems are very weak and who can't cope with it. But for most of us, so it's more a threat in some ways to society than it is to individuals.
We spoke to an immunologist on the programme on Saturday who was saying that, 50% of the UK population could be affected by the coronavirus if it arrives here. Are your members wargaming those sort of scenarios of what it would mean for the number of beds they would need to clear across the whole country?
So I think there's a series of escalation plans, and of course we're a very long way from the kind of scenarios that we've just described. But yes, there are a series of escalations about what you would do in different circumstances. The key advice, as if it does start to get higher, will be around self-isolation. That is the way in which we can contain this, because for the vast majority of people, they don't need active health service intervention. They can manage it through themselves.
And worth underlining the point you made a little earlier, that everybody turning up at the local GP clinic is not going to assist the spread.
That is a really bad idea. So when somebody is ill, if they think they've had contact with somebody who has coronavirus or they come from that part of the world, the answer is immediately self-isolate, dial 111.
Niall Dickson, good to talk to you. Thanks very much.